Hi, I'm Dr. Jason Torado, your West New York chiropractor, and today's headache alert, we're talking about how people keep taking ibuprofen and acetaminophen, and for some reason their migraine headaches seem to be getting worse, not better. Why is this? Well, it's really difficult nowadays not to know someone who suffers from some type of chronic headache. In fact, in 2004, I think the percentage of adults who actually experienced some type of headache or even migraine headache during the preceding 3 months was about 20%. I mean, that's a high number. Migraine headaches, which are typically characterized by like some type of an aura. Sometimes they see an aura, a lot of pain inside the head. Sometimes it's disabling. Sometimes there's nausea, and sometimes they even throw up. There's really no known treatment, and there's really no known cure. And a lot of them really occur mostly in women than men for some crazy reason. And the proportions of adults with migraine have really increased about 67 to 70% over the past 10 years. That's a huge skyrocketing number, and scientists do not know why. Your typical classic migraine headache is usually described with there's a common and then there's also classical. And symptoms of the common migraine headache include things like nausea, dizziness, people throw up, they'll just feel kind of just out of it. And the classical migraine is typically where a person will see that aura, like I explained before, that comes right before they get this headache. So they actually know that it's coming, right? They know that this headache is coming. And a lot of times this aura could be visual, right? In their field of gaze, and sometimes it could also be auditory, like they'll hear like a hum or a low buzz in their ears. In addition, the classical migraine headache is actually characterized by it's really short duration. It'll last a lot less than 12 hours compared with the common migraine. Well, that can actually last up to about maybe a week sometimes, 4 to 7 days. That's a long time with a headache. And although a lot of clinical studies haven't really clearly defined the cause of any of these headaches, a lot of risks or some of the potential risk factors come from things like diet, eating the wrong things, maybe allergies, poor air quality, sound, and a lot of stress. Also, a lot of people have stress, which triggers all these headaches. And a lot of patients nowadays, they use complementary treatments such as chiropractic care. And a lot of studies have also shown that patients that have recently had trauma, concussion, things like whiplash, are at typically greater risk for having these types of headaches. And cervicogenic headaches, which are headaches of the neck, that's actually a term for people that have had problems or neck pain that have led to headaches. And that typically happens from somebody getting banged in the head, or usually inside the neck or inside the upper back region. It's tension type headaches. With tension type headaches, there's usually a lot of muscle tension inside the neck, inside the shoulders, and typically that could actually begin a headache as well. And a tension type headache is where a person might feel a band of pain right around the head rather than some type of severe pulsating pain, which is typically seen in a migraine. Whatever type of headache is, most patients that have suffered for years, they seem to be just taking pain medication, pills and pills and pills over and over, ibuprofen, aspirin, tylenol, and they get some results, but they're always temporary. They can end up doing this and taking this for years and years and years. And sometimes the headache can initially get worse as the patient takes this medication, and then sometimes it'll get better later on. But it seems as if that people are taking more and more medication today to try to get rid of these headaches. It's really important to remember that a headache is simply, it's just a symptom. That's all it is. It's a symptom of something bigger that's going on. And covering up that symptom by taking these pain medications, it's not going to solve the problem. People have to understand that they're not there to solve the problem. Some of the physical approaches involving spine posture are really important, to consider, and are generally preferred to things like injections, sprays, and medications. Just a seemingly endless diet of pain medications with unknown safety is never the answer for patients with headaches. So if you do have headaches and you haven't tried going to a chiropractor, then maybe you might want to think about getting yourself checked out by a chiropractor. I know I've helped out tremendous amounts of people that have had headaches, and now they don't have headaches. But that's it for today. I'm Dr. Jason Torado, your West New York chiropractor. I'll see you soon.